Welcome to the Power of Care Spotlight. I'm Larry Moliterno with Meridian Community Care, here today with Dr. Dan Brown, who's our new medical director here at Meridian. And we just wanted to have an opportunity to kind of introduce you to everybody and talk a little bit about your role here at Meridian, because it's sort of a new direction that we're going as an organization. So give us a little bit of a sense about your background and some of the things that you've been doing.
Well, I'm the new medical director, and in that role I'm overseeing the primary care, the addiction medicine MAT programs, as well as overseeing our psychiatry department and the occupational medicine. My background is I came from a primary care background. I trained here in Youngstown at Northside Hospital in family medicine residency. I was a chief resident there in 2004. And I practiced for about 9 years in private practice on Belmont Avenue, and did really a full service primary care, inpatient in the hospital as well as in the office. And during that time is how I ended up coming to Meridian. I was doing a little 1 day a week here, starting in 2005, 2006.
Well, and I think that's another thing that I'd like you to help maybe explain to us, is because I think the time that you did come here, a day a week or so, mm-hmm. you really, I think, became attached to the kind of work that we do. Just tell me, what brought you here?
I really enjoyed the time that I came here. I was here, I think it was Thursdays, and I was here all day. And I started to realize that I actually looked forward to that every week. I really enjoyed it. And I think it's something that we do here that is different than what we see in primary care and preventative medicine that we have in our private office. We work all day trying to reduce cholesterol, blood pressure, and in the basic things that we call primary or preventative health. And a lot of times we don't see a whole lot of benefit from that. We know statistically we're preventing strokes, we're preventing heart attacks, but we don't see those things that we prevent. Mm-hmm. Whereas when you come here and we see these patients that we treat in the methadone or Suboxone, within a week or two we see an immediate turnaround in their lives, and we see immediate benefits of the work that we're putting in. So.
Well, and a lot of physicians that are out there, people who are running primary care practices, oftentimes our clients are not, I guess, attractive to them and the kind of work that they do. Why is that?
Well, because the type of clients we have right now, there's a large problem in our area with prescription pain medication, and a lot of these primary care physicians have been targeted by these patients when they were abusing in the past. They would go and attempt to obtain these medications, and a lot of times they're very manipulative in the way that an addict is. They need their medication and they'll do anything to get it, and so they'll try to manipulate physicians to get those. And so I think that's something that the primary care physicians become very jaded in this area, mm-hmm. towards those patients. And even when they come to them for assistance, sometimes it's not really something that they either want to provide or even know how to go about providing. So,
are the healthcare problems that our clients face, or because of, especially people who've been dealing with their addiction for a long time, are the healthcare issues kind of unique for someone who's running a primary care office?
To some extent. I mean, a lot of them, what we see is that the patients have health risks that exceed their age. So,
mm-hmm.
A 25 or 30-year-old male typically doesn't have a whole lot of health problems, whereas the 25, 30-year-old male that we see here, they tend to be much worse off as far as risk of infections. They have higher rates of hepatitis C, HIV. A lot of times they're smokers. We see COPD at younger ages in this population. So we see a lot of health risks associated with addiction that tend to appear at an earlier age.
And we know that people who struggle with an addiction have a life expectancy about 14 years less
mm-hmm.
than people who don't. So I think, and that is because they do have some, accelerated healthcare problems. So I think that one of the things that we're trying to do here, and by bringing you on board, is to work with this unique population that we have, not just working with the clients that we serve, but we're also providing occupational
mm-hmm.
health care for the businesses that we work with. We're also doing a lot of basic primary care out of our office now. That's one of the things that makes it unique in what we're doing here. So we're real glad to have you, and we're going to be talking a little bit more in future episodes here about some other things that we're doing here with our medical department. So if you want more information on what we're doing and some of the work that we're doing with Dr. Brown, please check out our website at meridiancommunitycare.org. Thanks, Dan.
Thanks.